Carpal tunnel syndrome is due to compression of the median nerve at the level of the wrist. It's the most common site of compression of any nerve in the upper extremity. When I see a patient for carpal tunnel syndrome, they will typically describe numbness in their hand. Typically, the numbness involves the median nerve distribution, which is the thumb, the index, the long, and then part of the ring finger. This numbness may be worse with certain activities, such as driving a car, and may wake the patient up at night, causing nighttime symptoms. Oftentimes, they'll complain that they have to shake out their hand to relieve their symptoms. Carpal tunnel syndrome affects approximately 5% of the population. If it's left untreated, the occasional numbness may become permanent, and the patient might suffer muscle loss in the hand, which can lead to loss of strength and loss of dexterity. There are many different treatment options for carpal tunnel syndrome. Typically, we'll begin with conservative measures first. That includes bracing, particularly at nighttime. We can also consider a steroid injection. The steroid is used to decrease the inflammation surrounding the median nerve in the carpal tunnel, and so this can be used as a diagnostic tool as well as a therapeutic tool. If a patient tries conservative measures with bracing and possible injection, and they still have symptoms consistent with carpal tunnel syndrome, it's at that time that we would recommend a carpal tunnel release. In this procedure, we make a approximately 1-inch incision centered over the palm of the hand, and we identify the transverse carpal ligament, which is the roof of the carpal tunnel. We release this ligament, which takes the pressure off of the median nerve, which is beneath that in the carpal tunnel. This is performed as an outpatient procedure, so the patient will come and go the same day. The surgery can be performed under local anesthetic alone, or we can do it under a local anesthesia with sedation, and this is entirely up to the patient and their preference.